The 5 itching patches that older individuals experience before they develop a major illness are the warning signals that doctors reveal for cancer. Have you ever experienced an itch that you simply could not account for? Was it one that refused to disappear? As we get older, our bodies begin to communicate with us quietly. A twinge, a bruise that appears out of nowhere, or a shortness of breath are all examples of symptoms that might occur at times. On the other hand, there is one signal that is frequently disregarded: pain that does not go away. At the same time, medical professionals are now stating that certain kinds of itching, when it occurs in very certain areas, may be an indication of something far more serious, a year before significant illnesses such as cancer or heart disease are discovered. Older persons frequently experience itching in 5 different areas, which we show in this video by revealing the locations. It's possible that each of the signs we're about to discuss has a deeper significance than you might initially believe. From the small indications on your back to the soreness in your legs. The presence of these particular sites, when combined with other symptoms, or when they persist without any apparent explanation, warrants a more in-depth examination, even though not every itch is a cause for concern. Furthermore, I would like for you to remain with me to the conclusion of this video because it is possible that you will not only notice these signals in yourself, but you may also recognize something early in someone that you care about. This comprehension has the potential to alter one's life. Now, let's get started. Primarily, itching in the upper back is the problem. A persistent itching sensation on the upper back, either directly between the shoulder blades or just below the neckline, is one of the early and most frequently ignored symptoms that medical professionals point out. In spite of the fact that many people in their later years attribute it to dry skin or discomfort caused by clothing, there is something more fundamental going on that requires your attention. An intimate connection exists between the upper back and various internal organs, including the pancreas, gallbladder, and liver. It is possible for a condition known as cholestatic pruritus to be brought on by something that is not operating properly, particularly when the bile ducts are blocked, or when the liver begins to collect damage. To put it another way, your body is attempting to convey to you that it is accumulating bile in an area where it should not be. And the signal that it is sending to you is not always going to be discomfort or exhaustion. It is causing irritation. It is not overt. It is a recurring episode. On the other hand, it is time to consider this itch seriously when it occurs frequently, continues for a number of weeks, or becomes more severe throughout the night. When older persons eventually discover that they have problems with their liver or pancreas, they frequently recall having experienced this kind of itching months before any serious diagnosis became apparent. An individual by the name of Robert, who was 74 years old, discovered that he was experiencing a peculiar and persistent itch directly under his shoulder blade. He tried everything, including a variety of soaps, lotions, and even a new detergent for the washing, but nothing was successful. A few blood tests and imaging were subsequently performed by his physician, who then determined that the patient had an early stage of bile duct cancer. We were able to treat it since they caught it in time. Itching could have been the deciding factor in his survival. One of the reasons why this particular region is a warning sign is because of the way in which the neurological system communicates with your skin. Back pain is a common manifestation of the internal stress signals that manifest themselves when your liver or pancreas begins to struggle. Any location where there is a significant number of sensory nerves that are connected to these organs. On top of that, it is important to point out that this itching is typically internal. It is not something that can be scratched away on the surface, rather, it has a profound quality. Moreover, the majority of the time, there is no obvious rash present. Because of this, it is simple to disregard. However, if you still experience itching in this region, even after applying skin creams, or if it does not appear to be caused by any external irritant, it is advisable to consult a medical professional in order to have your liver enzymes checked and a basic scan performed. The earlier you are able to identify a problem such as this, the better your chances will be. The itching is more than simply an annoyance. There are instances in which it constitutes a message, particularly among older persons, a signal that is being sent by your body, due to the fact that something significant is taking place beneath the surface right now. The second problem is that the lower legs are itching. In the event that you have experienced persistent itching on your lower legs, particularly in the vicinity of your shins or ankles, it is possible that you may have mistakenly assumed that it is simply dry skin or a seasonal flare-up. On the other hand, medical professionals who work closely with elderly patients have reported that this particular itch can occasionally be a subtle but significant warning of decreased blood flow or early-stage heart problems. The normal process of aging causes a slowing of our circulation, as the region of the body that is the furthest away from the heart. The legs are frequently the first location to exhibit symptoms of poor vascular health. This is especially true in the lower parts of the body, as a result of the blood not circulating through your veins and arteries in the correct manner. You may experience more than simply exhaustion and edema. Consequently, it may result in an accumulation of waste products in the skin. Itching is also one of the most prevalent responses that people have. Most likely, you won't see much, that there is no rash, no redness, and no swelling is possible. It's just that itch that doesn't go away, but it's so annoying that it seems like it's under the skin. It is considerably more severe for some individuals when it is nighttime. When circulation slows down even further, it is simple to disregard the situation. On the other hand, if it is persistent and does not respond to antihistamines or creams, it may be worthwhile to investigate further. Carol, who was 78 years old, disclosed that she had been experiencing persistent itching in her legs for around 6 months. She had tried every lotion imaginable, and she had changed all of them. Even more, she shifted to using natural soaps for her detergent. The itch, however, did not go away. The early-stage congestive heart failure that she was experiencing was not recognized by her physician until she went in for a routine checkup on her heart. Despite her best efforts, her heart was having trouble pumping blood effectively, and her circulation had begun to gradually deteriorate. When this occurs, the condition that is occurring beneath the surface of the skin is significantly more serious than what is evident on the surface. As a result of decreased circulation, oxygen and nutrients are not reaching the tissue as effectively as they should be. The result is that your skin becomes more sensitive, drier, and more irritating as a side effect. There is also a connection between itchy legs and illnesses such as peripheral artery disease, which causes blood vessels to become more constricted and further inhibits blood flow. If you have observed that your lower legs are itchy and also feel chilly, weak, or numb at times, or if you see any color changes or ulcers forming, it is important to talk to your doctor about the situation. And the issue is not limited to cardiovascular disease. This sensation can be brought on by a number of conditions, including diabetes, kidney illness, and chronic venous insufficiency. One must pay attention to the pattern in order to be successful. Is the itching persisting in these lower legs of yours? When it comes back, does it happen every night? Are you finding it more difficult to walk or carry out the things you normally do? Do not write it off as merely dry skin if that is the case. Make sure to inform your healthcare practitioner. If you perform a straightforward examination of your circulation, blood pressure, and heart rhythm, you can discover something that has been developing in the background for several months. I would appreciate it if you could use the second comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Now, let's proceed with our plans. An itchy sensation on the chest and upper arms is the next symptom. It is common for it to go unnoticed when itching occurs on the chest or upper arms, particularly when there is no obvious rash or irritation present. The vast majority of elderly people believe that it is a result of a shift in the weather, a new fabric softener, or just a sign of aged skin. On the other hand, there is an additional possibility when this form of itching persists for an extended period of time, particularly when it is felt deep within the skin rather than on the surface. Internal cancers are receiving an increasing amount of attention from medical professionals. One of the disorders that is most frequently ignored is lymphoma, which is associated with chronic itching that cannot be explained. In point of fact, a significant number of individuals who are subsequently diagnosed with specific types of blood cancer recall that their initial symptom was not a lump or weariness, but more specifically, itching. Furthermore, the trunk of the body is typically where this itching first manifests itself, notably across the chest or the upper arms. One of the reasons for this is that your immune system reacts differently to malignant cells than it would otherwise. Chemicals such as cytokines and histamines are released by the body as the disease begins to develop internally. These chemicals have the potential to irritate the nerve endings in the skin, which can occur long before other symptoms demonstrate themselves. The end consequence is an itch that is persistent, comes and goes, and does not react well to moisturizers or tablets that are prescribed for allergies. It is possible that at first it does not appear to be an urgent matter. Several days may pass without you noticing it, and then all of a sudden you will feel that itchy sensation returning, particularly at night or after a warm shower. Some people have described it as a feeling similar to crawling, almost as if something is slightly beneath the surface of the skin. Others claim that it does not cause them any pain, but rather that it is always present and quietly bothers them when they are least expecting it. There is also a certain pattern that the medical professionals have noticed. The hands and face are not typically affected by this type of itching, rather, it is more prevalent in parts of the body that contain a high concentration of lymph nodes, such as the chest, the underarms, and the upper arms. Your immune cells are stored in this area of your body, and it is also the place where the first signals of disease can quietly start to appear. Take, for example, the story of Harold, a man from Oregon who is 81 years old. Around the same time, he began to experience itching on his upper arms as well as across his chest. In the afternoons, he started experiencing a remarkable level of fatigue. He didn't give it much thought and attributed it to the effects of becoming older. On the other hand, when it did not disappear, his physician performed a number of tests, including a blood panel and a scan. As it turned out, Harold was suffering from Hodgkin lymphoma, which was in its very early stages. His therapy was successful, and he continues to garden in his backyard to this day. This is all due to the fact that they caught it early on. Let's get this straight now. Itching on your chest does not necessarily indicate a serious condition. When it is, however, profound, persistent, and unrelated to any skin condition or environmental element, it is something that should be taken into consideration. It is time to consult with your doctor, particularly if you have noticed other symptoms such as inexplicable exhaustion, night sweats, or weight loss. Therefore, even if those symptoms are not present, you should not be afraid to inquire about them. The results of a simple blood test and physical examination can often clue your doctor into the possibility that something more serious is going on. It is not the itching itself that poses the greatest threat, rather, it is the fact that you disregarded what your body could be attempting to communicate to you. As someone who has lived through as many years as we have, you come to realize that the body is something that whispers before it shouts. In addition, the sooner we pay attention to the hushed voice, the more time we will have to take action regarding the matter. Irritation on the scalp is the fourth symptom. Let me tell you something that might take you by surprise. At some point in their lives, the majority of people, particularly those of us who are in our 60s, 70s, or older, have experienced a scalp that is dry or itchy. In many cases, we attribute it to shampoo, the effects of aging, or even the weather. On the other hand, if the itching on the scalp is chronic and cannot be explained, especially in cases where there is no dandruff or visible skin, Irritation may sometimes be an indication of something that is occurring much deeper within the body. The nerve endings and blood arteries that make up your scalp are densely packed. And when something changes inside your body, particularly with organs like your kidneys or in your endocrine system, it can cause an itch that feels almost like it is coming from under the skin. This is especially true when certain organs are affected. The dryness is not on the surface level, but rather a sense that is more difficult to access. This type of itching on the scalp is something that people who have chronic renal disease frequently feel. And it can occur for a considerable amount of time before they become aware that anything is amiss. When the body begins to have difficulty filtering out pollutants, the chemical buildups that occur in the body have an effect on the nerves that are found in the skin. On account of the fact that your scalp contains one of the most abundant nerve supplies in the body, it is one of the first locations where you will feel it. The similar thing can occur with problems with the thyroid. In the event that the thyroid is either overactive or underactive, it disrupts the equilibrium of your skin function. It is possible that you will not immediately notice the sluggishness or the variations in temperature, yet your scalp will feel it. It is also common for no amount hair conditioner or medicated shampoo to be of any assistance. That is the essential point. The sign is not very loud. Throughout the day, you can find yourself scratching your head without being able to identify the reason for it. At night or after you have had a shower, you could find that the itching is more intense. In addition, you might not even notice any flaking or redness. That is the reason why it is so difficult. Everyone else is unable to see it, except for you. One of the women I met, whose name was Eileen 76, was often telling her daughter that her scalp was itching all the time. Switching shampoos, going to a dermatologist, and even purchasing a humidifier for her bedroom were all things that she attempted to do. But nothing was successful. At some point, she went in for a comprehensive examination, and the results of her blood work showed that her kidney function was below the usual range. She was unaware of any more symptoms at the time. Nothing to swell. There is no exhaustion. It is only the itch. The first clue was that it was. In some cases, it is not dramatic. In point of fact, the ones that are silent are frequently the most hazardous. It is for this reason that you should pay attention to this type of scalp itch, especially when it does not react to conventional treatments and when it continues for a period of weeks or months. Particularly if you are also observing other minor adjustments in the situation. Alterations in urination, interruptions in sleep, and shifts in appetite or mood are examples of such changes. Along with that, there is a neurological component to this. Whenever the body is under stress, particularly as a result of an internal ailment, the nerves themselves have the potential to malfunction, resulting in itching sensations that have no apparent reason. Due to the fact that these itches are genuine yet not apparent, they can be extremely frustrating. You are aware that it is present, but there is nothing on your scalp that should be seen to a physician. As a result, it is essential to make one's voice heard and to request a more comprehensive assessment. Checking the function of the kidneys or even performing a thyroid panel could be all that is required. This could result in the earlier diagnosis of something that is significantly more dangerous. However, if you choose to disregard it or assume that it is merely a natural part of becoming older, you may put off receiving care that you actually require. It is therefore important that you pay special attention the next time you find yourself scratching your head. Not because you are confused but rather because you have an itch that won't go away. Perhaps your body is attempting to communicate something really significant to you. I would appreciate it if you could use the fourth comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Now, let's proceed with our plans. Itching on the palms and soles of the feet is the fifth type. Let's move on to the next topic, which is one of the signals that is frequently misunderstood and ignored. You may have a severe itching sensation on the palms of your hands or the soles of your feet if your body is causing it. It is possible that at first look it appears to be little, or even merely annoying. On the other hand, chronic itching in these very particular regions can be an indication of deeper problems that go far beyond dry skin or seasonal allergies in older folks. In the palms and soles of the feet, nerve endings, blood arteries, and sweat glands are packed in close proximity to one another. These areas are frequently the first to feel the effects of any changes that occur in your internal health, particularly when it comes to your metabolism, blood sugar levels, or even your neurological system. This is because of the fact that these areas are associated with the nervous system, especially when it is not associated to a visible rash or a new medication. Persistent itching in the hands and feet can sometimes be an early warning sign of deteriorating diabetes. According to the findings of an investigation conducted by medical professionals, the condition known as diabetic neuropathy occurs when the levels of sugar in the blood rise and nerves begin to experience a minimal amount of damage. Itching is considered to be one of the first sensations that people describe, rather than pain or numbness. This itching might have a peculiar, almost electric sensation. It could be difficult to find exactly where it is. It is as if something is crawling beneath your skin rather than just a sensation. At times, it manifests itself throughout the night, and at other times, it manifests itself after doing something or being exposed to warmth. A man by the name of George was involved in one instance. As I recall it very vividly, at the age of 80, he had been successfully controlling his blood sugar levels for more than a decade. On the other hand, during one summer he began to complain about a severe itching sensation that crawled across the bottoms of his feet. There was no rash or redness, it was just this sensation that drove him absolutely insane. Particularly during the night. Initially, he believed that it was his socks or even athlete's foot, but nothing helped him find a solution. In the end, he was examined, and it was determined that his blood sugar had gradually increased without any noticeable change, and that nerve inflammation had already begun. Diabetes is not the only condition that can cause itching in these locations. Liver disease, particularly disorders that interfere with the synthesis or processing of bile, can also be a contributing factor. When there is an accumulation of bile acids in the bloodstream, they frequently manifest themselves in the hands and feet first. This results in a severe, irritated itch that does not go away. Even further, there is some evidence to suggest that itching in certain areas may be the initial symptom of certain neurological illnesses. It is possible for the nerves in your skin to become confused and send itching impulses when the central nervous system begins to malfunction. This can occur even when there is nothing on the surface that is wrong. What makes itching in the palms and soles of the feet particularly challenging is how simple it is to explain away. Do you think it's the socks? The shoes could be brand new. Perhaps the weather is to blame. This is what the majority of people believe until the symptoms persist for several weeks, or until they begin to disrupt their sleep, or until they gradually spread to other areas of the body. This form of itching, in contrast to itches brought on by insect bites or irritants, does not react favorably to lotions or antihistamines that are available without a prescription. That's typically the most telling sign that it's resistant. It does not adhere to the standard guidelines. Thus, what should you be looking for? Pay close attention to the periodicity. Is the itching something that occurs on a daily basis, particularly during periods of stillness, such as right before bed? You may also be experiencing other changes, such as a feeling of exhaustion, an increase in thirst, tingling sensations, or variations in your weight. All of these are indications that it is time to consult with a medical professional. The sensation of itching may appear to be a trivial matter, nevertheless. When it is intense, persistent, and concentrated in certain areas such as the hands and feet, it may be your body's subtle way of requesting assistance before something more severe takes root. You have learned a great deal throughout the course of your life, and one of those lessons is to trust your intuition. There's a good reason why they've carried you this far. Lastly, some thoughts. When we are becoming older, it is simple to disregard little annoyances, such as chronic itching, as only another part of the process of getting older. However, your body frequently communicates with you in a manner that is not immediately obvious. And if you ignore these cues, you can miss a serious health problem. There is a possibility that every itch you have, whether it be on your back, legs, chest, or even your palms and soles, is trying to convey with you a significant message. It is possible that being diagnosed with diseases such as liver disease, heart problems, or even cancer at an earlier stage could significantly improve your chances of receiving effective treatment. Listening to your body, paying attention to the patterns, and speaking out when anything bothers you are the most important things you can do. Despite the fact that it is tempting to ignore these relatively minor annoyances, taking action right now could end up saving your life. Make sure that you do not overlook even the most insignificant of indications. One of the most important things you can do to ensure that your health and well-being are preserved as you become older is to take preventative measures. Your body is attempting to communicate with you in some way. Believe in it. We appreciate you being here with us today. It would be wonderful if you could get in touch with us. Please leave a comment below and tell us about one item you discovered today and how you intend to put it to use in your life right now. We place a high value on your opinions, so please do not be reluctant to share them with us. Our inspiration and encouragement are greatly increased as a result of reading your remarks. I would appreciate it if you would like, subscribe, and share this video if you found it to be informative and enjoyable. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. We appreciate you taking the time to watch, and we hope to see you in the future video.